Hello, my name is Debbie Friedman. I'm the Trauma Director at the Montreal Children's Hospital, and I'll be speaking to you on behalf of our Trauma Center, which is part of the McGill University Health Center. Today I'll be discussing the topic of educating, preventing, and managing concussions. As I mentioned, I'm the Trauma Director at the Children's. I'm also the Director of the Canadian Hospital's Injury Reporting and Prevention Program, and I am an Assistant Professor in the Department of Pediatrics in the Faculty of Medicine at McGill University. Injury prevention is an important part of management of concussions, and it's also an important part of our mandate as a trauma center. We have a dynamic program that involves injury prevention recommendations, the development of educational resources on a whole variety of topics, but certainly we have a lot on concussions, public awareness, community outreach, partnership development, networking, knowledge sharing, and a lot of which is done through our website and used across the province by regional centers and elsewhere as well, and of course research. We have a close affiliation with the Public Health Agency of Canada's Canadian Hospitals Injury Reporting and Prevention Program, which is an important national surveillance program and we've witnessed firsthand, has actually been used in terms of legislation, product recall, and recommendations. Our approach to injury prevention at a trauma center really is one that balances activity while promoting awareness of risks and encouraging informed choices. I think we would all agree that active kids is important for their physical, for their psychological, and for their social well-being, but of course they have to make smart choices. And we've also been acknowledged by accrediting bodies as leaders in this area. It's important that we understand prevention, and the approach I'm taking today is the management of concussions through primary, secondary, and tertiary prevention. Of course, primary prevention is protecting healthy children and teens from becoming injured in the first place. Secondary prevention would be once the injury has occurred, prevent disability or re-injury and make sure that proactive early management is implemented. And then tertiary prevention for helping children and teens manage the long-term effects of an injury, which in many cases can include rehabilitation, counseling, and helping them to develop coping strategies. I'm going to start off by just sharing with you something we're very proud of. It's our Trauma and Injury Prevention website, which has a tremendous amount of information on many different topics and has a big section on the management of concussions and a resource section that's widely used by community physicians, regional centers, schools, summer camps, and the media and many others. From a point of view of primary prevention, what do we do? So we really want to promote health through injury prevention. One of the key ways to do it is to educate about reducing the risks of injury and also about educating about things like recognizing symptoms early on, seeking medical attention, never playing through an injury. So what it's important to do, since we clearly can't be everywhere, is to develop partnerships where everyone is diffusing key messages. So we've worked closely with community docs, health professionals, schools, summer camps, sporting association, community organizations, and policymakers. We've done it through community outreach events where we may set up a kiosk and have hands-on activities that are interactive and get the message across for the different age groups. We have all kinds of educational brochures and information that we prepared. We've done a poster campaign for different sporting events about concussion and key messages, and we've also developed our concussion kit, which we are looking forward to coming out with our third edition in the fall, which has been widely used by sporting associations and by many community physicians and regional centers. Aside from education, we provide clear recommendations and, of course, things like no checks to the head rule in hockey, reducing head-to-head contact in football. But more than that, also giving the message about how important it is to adhere to the rules, respect fair and practice fair play, use protective equipment, but also appreciate the importance of skill training. Also, we've been involved in encouraging environments and as well as advocating for legislation and clear regulations. So some of these I mentioned already, but we've also been involved in having trampolines banned from the regular school physical education program. We're one of the centers involved in the banning of baby walkers. We've been advocating for a long time for helmet legislation, although it's not so simple to get this implemented in Quebec. We've managed to succeed in certain communities, but not province-wide. We've advocated for the reduction of legal blood alcohol in Quebec. We've also been very key in terms of diffusing the very erroneous message about the safety issues with turbans in soccer, when the Quebec Soccer Association tried to use that as a reason to have kids not play, and it was actually using the CHIRP data that we were able to diffuse this, and looking at over 20,000 Canadian children playing soccer, there was not one injury related to turbans. We've also, following the death of a child, we're also very involved in having diving board changed in the city, as many of them did not meet safety regulations. So we've done many to get the message across. We've also, from environmental perspective, we've been involved in anchoring of soccer nets, changing of playground equipment. We've been involved in getting ads like the one from Bro and Martineau, which talked about keeping a colicky child on top of the dryer, but didn't mention anything about standing next to the kid while they're on the dryer. That was kind of cool, because within about 4 hours we got them to pull the ad when we went out with an emergency alert. We've also been involved in things like mandatory fencing surrounding all home swimming pools. In Quebec, there was a rule that came out for new construction in 2010, but for some reason nobody drowns in old pools from their perspective. So we've been trying to get the message that a pool is a pool is a pool. Also looking at the conditions of terrain for different sporting activities, toy recalls, and advocating for the use of helmets for go-karts. In terms of outreach events, again, we have to be creative and find different ways to reach different partners and get the message across. And there's not just one way to do it. We've really tried to do it in many different ways. So, of course, we've done press conferences, and we launched our concussion kit and talked about what is a concussion and signs of prevention and never playing through an injury. And we've partnered even with the professional sporting associations to get that message across as well. We presented at different conferences. The members of the MTBI team have gone into the schools, because I think a lot of emphasis is sometimes placed on the physical aspect and working with the physical education teachers and the coaches, but really these kids spend so much time in the classroom, and the teachers really need guidance as to how to reintegrate, how to support the child, how to modify their program, what is reasonable expectations, because I think we all know that when a child comes back with a broken leg and crutches, everybody's ready to help him, but when a child comes back with a concussion, it's not always immediately evident as to what their challenges are. We've worked with summer camps where we see a lot of kids with concussions, and we've done a lot of training with the counselors as well. Sporting associations, with the coaches, the parents, the athletes, the trainers. We've presented to community physicians, and many of the community physicians refer to our website on a regular basis and use our educational resources for their offices. We've worked on northern community projects to try to get the message out in northern Quebec, which required a little bit of a different approach. We actually did a teaching video for some of the communities. We've also participated in large-scale events like Salon de Maternité Paternité. We've developed a program in conjunction with McGill Medical School called the Osler Medical School Volunteer Program. So we actually get second and third and sometimes fourth-year students involved in being some of our volunteers, so that they do have some information that they can respond to answering questions about concussions and going into the schools and teaching the kids. We've had numerous in-house prevention days within the hospital, and we've participated in other sports tournaments and community events. Also, in terms of getting the message out, certainly using the media is an important tool, and we've done a whole slew of different types of interviews. What's also important from our program is secondary prevention, and we've implemented a program to really educate about recognizing symptoms of a concussion early on and clearly giving the message of never playing through an injury. program begins from the time the patient is seen in the emergency or the community doc's office. So from the onset, everybody is given the right information and then has easy access for referral to our clinic. And one of the key things is to normalize the expected recovery, and Lisa will talk a little bit more about these different aspects of her talk. The tertiary prevention is important because we're dealing with some high-performing kids, whether it's music or drama or sports, and sometimes after repeated concussions, there is a real risk, and they really do require a tremendous amount of psychological, emotional support and help in terms of coping with their new reality. And we try to, which Lisa will discuss as well. So thank you very much.